Hi everybody. I thought I would have a quick video to add to the library today regarding immune boosting supplements. The list behind me was accumulating during the initial part of the COVID epidemic. A lot of it has been developed for a science-based approach to immune boosting through supplementation. Anybody that has been in my office knows that we go through these routinely, as supplementation can help prevent disease, promote healing, and immune boosting has been a big part of everything we're doing here in the office during COVID, especially with the intravenous program with glutathione, phosphatidylcholine, etc., Myers cocktails. Before I start, to my patients, you know that we're going to go over specifics about the dosing of supplements. Some supplements need to be monitored very carefully as to not overdose on them or take too many of them. If you're not my patient, then this is certainly not medical advice. This is just a general informational video regarding a lot of the science-based facts regarding how you can help boost your immune system during the flu season or just in general. And remember, the immune system is not just important for fighting infections. It has a lot to do with cancer prevention and other very important functions in the body. So let's get started. Vitamin C. We all know vitamin C is one of the body's main antioxidants. It seems like a high dose up there, 4 to 5,000 milligrams, but that's in divided doses, and this is during an acute infection. On a regular basis, about 1,000 milligrams would be adequate for general immune boosting. But during acute infection, taking a certain amount of vitamin C, especially in a powder or liquid form with better absorption, helps very much get your immune system boosted, which helps fight off a viral infection. Remember, viruses are not alive like a bacteria. They are basically genetic material that take over your own cells functioning. So your immune system needs to take back control, and that is strengthening the immune system is the key to getting a viral infection gone, as well as decreasing the length of time. Vitamin D is my most important supplement. Now, 5 to 10,000 units up there is not a general recommendation. First of all, most people shouldn't take 10,000 units. It's too high of a dose. You should always base the dosing on blood levels. Most people need to take between 3 and 5,000 units a day, and that's pretty adequate for immune boosting, but you should always get your levels checked and base your dose on the levels. Zinc is considered the cure for the common cold because it's an antiviral. So zinc lozenges, taking extra zinc, definitely helps decrease the viral load and has been shown to get people feeling better quicker and basically symptom-free and virus-free quicker. Coenzyme Q10, people who take statin cholesterol-lowering medications know about this supplement, but it's also a very important antioxidant, and it helps coordinate other immune system functions. So people that have a well-boosted level tend to do better, especially with viral infections like the flu, COVID, rhinovirus, and others. The next one called resveratrol and quercetin. Now, this is a combination pill that I take it. The more important of the two during a viral infection is the quercetin. That quercetin acts as what's called a zinc ionophore. It helps deliver that so important zinc into the cell, but it helps get in there even quicker, and in doing so, gets rid of that viral load, helps your body recover quicker. Resveratrol is just a good antioxidant immune booster. The next two, N-acetylcysteine, known as NAC, and lipoic acid, those are the two of the most important building blocks for glutathione. Glutathione being your body's #1 antioxidant. But as stated earlier, intravenous glutathione is the delivery route. Oral glutathione does not get good absorption because of stomach acids, etc. So you can take the building blocks to increase your glutathione levels, and remembering glutathione is the most important antioxidant and thus immune booster in your body, naturally occurring. Modified citrus pectin is something I recommend in general anyway, as been proven to decrease the risk of certain cancers and metastases from cancer, but also has a very potent immune boosting function. And so I add it in a powder to my water and other things. You can take it in pill form as well. Moving on, the probiotic, everybody's taking that every day. When you're sick, maybe double up on it. A probiotic is basically helping your body produce the immune system cells and other helper cells that are used to support your immune system. Medicinal mushrooms are similar, but medicinal mushrooms actually act directly on the immune system cells by replenishing it with certain enzymes and antioxidants that help the immune system work better. So mushrooms of any form have been shown to always help immunity. They also have other very good biologic effects, such as some anti-cancer data, etc. Melatonin, which I always thought was more of a sleep aid, has been shown to be one of the most important immune boosters, probably for its coordination of other hormone production and release and keeping your circadian rhythm normal. So even if it's not for insomnia, taking a small dose of melatonin has been shown to decrease the length of a viral infection and decrease the viral load. And last but not least, the EGCG is green tea. So drinking green tea while taking the zinc, while taking vitamin D, has been shown to increase the delivery of those supplements into the cell and thus bringing down the viral load, decreasing the viral infection. So you can see there's a trend here. It's all about assisting your immunity, just like a good night's sleep. Exercise in general helps an immune system. During an acute infection, that's why sleep and hydration and electrolytes are so important. Your body needs all those ingredients to recharge the immune system. People do not need to take this entire list of supplements to have a healthy immune system. And I want everyone to remember that not everybody should be taking high doses of things like vitamin D or other supplements without consulting me or your doctor. But generally speaking, we can do a lot to mitigate the severity and even the incidence of these fall, winter viruses by simply boosting up on some of these supplements, as well as making sure your lifestyle habits are in check. Sleep, exercise, good food. Hope this helps. See you soon in the office. Stay well.